Hello, everyone, and welcome to this audio podcast. This audio podcast looking at looking at looking at nephrology and public health and sort of long-term conditions or long-standing conditions and health inequalities, and where this works in collaboration was in collaboration with was in collaboration between was in collaboration between the RPSG the RPSG and KDOS. So so education and consultations through online spaces, and where patients or service users have access to peer support and allied health professionals allied health professional involvement would help to prompt smarter care. Providing service users sort of education that is centric and surrounding clinical and non-clinical scenarios is important owing to changes in healthcare and disease over time. And healthcare professionals are prompted to keep up to date with aspects that surround at-risk patients, at-risk sort of service users, and consult sort of nephrological guidance where in most applicable. So a stance is now required or is required where healthcare educational interventions constitute service equality and improvement. So the aims, some definitions, some additional sort of definitional bases or underpinnings, if you like, before looking at sort of the aims. Looking at the aims. uh, so healthcare is best when there is a position to deliver the National Health Service long-term plans that aim for sort of a triple, what's been referred to as evidence as triple integration of primary and specialist care, physical and sort of well-being services, and especially if connectivity is unified through what has been a sort of a as part and what has been a sort of a specific sort of interlink in around healthcare and around healthcare network in the United Kingdom, known as health and the healthcare sort of network, or HSCN. And this can allow sort of interconnectivity in healthcare that meets compliance. The HSCN should allow sort of an untapped area of focusing on education provisions surrounding disease trends through e-health. And HSCN provides sort of an underlying network arrangements to help integrate and transform healthcare services by enabling care organizations to access and share information more reliably, flexibly, and efficiently. So, in around the aims of this works was number one, to identify whether service users with CKD would approach healthcare professionals and peers peers through online consultations and educational support, thus prompting collaborative efforts. And two, to understand if and whether service users would welcome more integrative support from healthcare professionals through, for example, social media, wherein service users and healthcare professionals can bridge gaps across health inequalities. So a little bit around sort of the health around sort of a little bit around the healthcare complexity. So so to begin with, it is predicted that the number has been predicted, or evidence that the number of people with long-standing conditions will remain relatively stable over the next sort of or over the next or sort of few years or several years, although the number with multiple long-standing conditions known as multimorbidity is set to increase from 1.9 million 1.9 million from what was from evidence or published works or in literature from 2008 to 2.9 million in 2000 to 2.9 million in 2018. So this consequently has an impact on healthcare and lives, and the 30% of the population with long-standing conditions sort of account for sort of over 70% are around national health service national health service sort of provision. So reducing now sort of reducing people's dependence on healthcare professionals and increasing the sense of control and well-being is perhaps a more effective way of healthcare in our healthcare and provision. And despite her overwhelming evidence, people with long-standing conditions and/or disability can face several challenges regarding discrimination and/or ignorance, and people may feel disenfranchised and have perceptions of helplessness and feelings of powerlessness against a backdrop of diminished health. So now in around looking at healthcare and national health services and some specifics around population health, healthcare education, and online spaces and online spaces and portals. So first, in around population health. So first announced sort of in around 2003, the term or terminology population health was used to describe health outcomes surrounding disease trajectories across health conditions. Population health has now progressed to include identifying people at risk of long-standing conditions according to the severity of illness demographics and broader bioinformatic parameters to identify risks in leveraging resources to improve healthcare and outcomes. So in around the healthcare education aspect, healthcare education has diversified for service users with long-standing conditions over the past few years up to sort of over a decade and so patients or service users with long-standing conditions use, for example, the internet to access peer support groups through social media, and whilst it can be helpful, peer support alone does not override the necessity for educational support. And it is in this context that healthcare service users either become more informed as decision makers or misinformed around disease trajectory, leading to compromised quality of care. So in around sort of online spaces and portals, online spaces have allowed patients or service users with long-standing conditions to access information relating or regarding to health and disease, including through the National Health Service, NHS websites and portals, and patient-based, service user-based organizations, and various other various other sort of pathways. And the current concern has been that despite the tech advances, integration between information searching versus knowledge implementation differs between and across long-standing conditions. Information available over the internet can be vast, and much of it can be daunting and lead to hindrances. and the issues which appear in healthcare have risen from a lack of understanding about the multidimensional nature of service of a service user and sort of public involvement, or patient and public involvement. So now in around looking at sort of sort of challenging inequality and some conclusions. So information and communication technology, or ICT, so reducing people's dependence on healthcare professionals to some aspects, and increasing a sense of control and well-being is a more effective way of developing joined-up thinking between service users and service providers. There are sort of a wide range of initiatives to support, including information leaflets, online sort of peer support, one-to-one sort of uh, educational sort of intersections, and use of social media with tech and and sort of self sort of self sort of self management or self management or interventions. Initiatives can be categorized along a column with passive information provision about people's condition, and sort of and sort of technical sort of aptitudes at one end, and initiatives that more actively seek to support self-management and increase self-efficacy at the other end of the continuum. So in around sort of shared decision shared decision sort of focuses on uh, in around sort of shared decision focuses the involvement of citizens in decisions about healthcare and healthcare provision and planning and service provision have been introduced in several countries, including the United Kingdom, Canada, Holland, and Australia, and the public involvement, and support, public involvement and support are needed to promote in sort of are needed to prompt sort of inventiveness and sort of research which needs to reflect, or should reflect, the public's intrigues and values, in line with research and challenging aspects that encourage inequality and patient and public involvement has become a sort of main component a main component health in around healthcare and research in amongst the United Kingdom. PPI, or patient and public involvement, gives healthcare service users the opportunity to be part of a solution to establish advantages around healthcare, and tackling or challenging inequity through research and involvement. PPI is also an important mechanism for introducing necessary healthcare through research, and allows to improve the quality of healthcare. The essential changes are the belief that involving service users in healthcare leads to improving quality of healthcare through participation. So now in around some conclusions and some and then some conclusions and a summary. So service users are the intermediaries between healthcare sectors and services. CKD service users, or those long-standing conditions, now have more opportunities to share lived experiences, owing to the nature and implementation of social media platforms like the RPSG and like KDARs. In addition to sharing experiences, this prompts service users to be more than mere recipients of healthcare, and where service users become more empowered so that more informed decisions can be made. So, in around the summary of this works, educational intercessions are required generally to offset issues where there are inequalities, but also to ensure excellence in healthcare practice. Patients or service users would welcome healthcare professional involvement through online platforms, and the above notwithstanding, future or prospective research should look to encourage development of a novel framework or guideline to inform streamline educational support and highlight what CKD education in healthcare could look like with healthcare professional involvement to bridge health inequalities through for example RPSG and KDAR's platforms. Overall, collaborations across and between sort of collaborations across and between industry and health sectors are required to bridge practice excellence.